So, when you hear the word massage, what comes to mind? Probably a relaxing spa day, right? Fluffy robes, calming music. But there's this whole other world of massage therapy that's less about luxury and way more about diagnosis and treatment. It's called clinical massage therapy, and it looks at the body as this incredibly complex system to solve really specific problems, like pain and dysfunction. So, how does it actually work? Let's get into it. Over a century ago, the writer Marcel Proust absolutely nailed the central mystery that clinical massage therapists try to solve every single day. He's talking about that frustrating, all over pain that seems to just magically disappear, but only if you can find its true source. And in this explainer, we're going to be detectives and uncover exactly how therapists find that precise spot. Okay, let's make this personal for a second. Think about that nagging ache you get in your shoulder, or maybe a tension headache that just refuses to leave. Your first instinct is to rub the spot that hurts, right? Of course it is. But what if the real problem, the actual culprit, is hiding somewhere else entirely? To answer that question, we have to put on our detective hats. We're going to go searching for clues deep inside our soft tissues. And we'll start by looking at the three most common culprits that are usually behind the whole thing. It all begins right here, deep down at the microscopic level. Your muscles are made up of all these fibers that are designed to do one thing, contract and release. But sometimes, maybe because of an injury or even just stress, these tissues can get, well, stuck. They become persistently shortened. And a muscle that's already tight can't generate any power. Instead, it just starts pulling everything else out of whack. Now, here's where things get really interesting. Everything in your body is wrapped in this stuff called fascia. The best way to picture it is like a full body stocking that you're wearing underneath your skin. Now imagine you get a little snag or a twist in the ankle of that stocking. You're going to feel that pull all the way up in your hip, right? This idea was a huge game changer. It shifted how we see the body, not as a collection of separate parts, but as one single interconnected network. A problem in one tiny area can cause pain and tension somewhere completely different. And that brings us to our prime suspect, the trigger point. This is that precise spot Proust was talking about. It's a tiny, super irritable little knot in a muscle that doesn't just hurt right where it is. Oh no. It can shoot pain out to other seemingly random areas. This is called referred pain, and it's the reason your headache might actually be coming from a problem in your neck. And get this, these little troublemakers come in two varieties. You've got your active trigger points, those are the obvious ones, they're causing you pain right now. But then you have the sneaky ones, latent trigger points. They don't hurt at all until a therapist finds them and pushes on them. You could be walking around with these hidden problems, totally unaware that they're a silent partner in that fascial tug-of-war, messing up your body's overall balance. So if the pain we feel is often just a symptom, like a blinking check engine light, how does a therapist figure out the real cause? Well, this is where the clinical part comes in. The therapist basically becomes a detective, gathering all the evidence before they even think about starting treatment. And this is really what separates a clinical session from a general relaxation massage. It always starts with a thorough assessment. The goal isn't just to make you feel good for an hour. It's to form a working hypothesis about why you're in pain and then create a plan to systematically fix it. This assessment is this really cool mix of art and science. Therapists use their eyes, for sure, doing visual exams, looking for imbalances in the way you stand and move, but they also use precise tools, like the palpation meter you see here, to get real, objective data on your body's alignment. They can measure even tiny differences in hip or shoulder height that could be the key to the entire puzzle. I absolutely love this metaphor from the source material. It's such a perfect way to explain what happens with opposing muscle groups. If the muscles on one side of a joint are always tight, they're constantly winning this tug of war against the muscles on the other side, literally pulling your skeleton out of alignment. All right, so once the detective work is done and the culprits, the tight tissues, the fascial snags, the trigger points, have all been identified, the therapist opens up their toolkit. And these are not random rubbing techniques. These are precision tools, and each one is designed to fix a very specific kind of problem. First up in the toolkit is a technique called stripping massage. So as you can see, the therapist applies this deep, gliding pressure that moves along the direction of the muscle fibers. The goal here is to manually persuade those shortened tissues to lengthen out and just let go. It's almost like having a direct conversation with the muscle, encouraging it to finally release that defensive grip. Next in the toolkit is a technique with a completely different approach. It's called cross-fiber friction. So with this one, instead of moving with the fibers, the pressure is applied across them. This is designed to break up tough adhesions and scar tissue. You can almost think of it like strumming a guitar string to restore movement and function right where it was lost. Okay, understanding all this stuff is incredibly powerful, but this knowledge comes with a really big responsibility to be safe, especially when you're working on your own body. And I am serious about this. This part is so important. While self-massage can be a fantastic tool, there are very specific times when you need to avoid it completely. Specifically, you have to be on the lookout for signs of a possible infection. If you have swelling with changes in your skin color, and this might look red, purple, or even gray depending on your skin tone, or if the area is warm to the touch, tender, or you have a fever or chills, you might have an infection. Do not perform self-massage. This is absolutely non-negotiable. If you see any of those signs, your first and your only step should be to get medical attention immediately. Your health is priority number one, always. Okay, let's zoom back out and bring this all together. From that tiny, microscopic muscle fiber to that huge web of fascia, the main idea of clinical massage therapy is all about seeing the big picture. This quote right here really is the central takeaway. Your body isn't just a collection of separate parts. It's a completely integrated system. The source material gives a perfect example. A client sprains their ankle. They start favoring that leg, which makes the muscles in their hip tighten up, which then throws their back out of whack, and eventually that causes a tension headache. You see, just treating the neck isn't going to solve the problem. And this is what that looks like in practice. It's about understanding that whole chain of events. True, lasting relief doesn't come from just chasing the pain around. It comes from finding and treating the source of the problem, the very first domino that fell in that long chain. So I want to leave you with this thought. The next time you feel a persistent ache or a nagging pain, instead of just seeing it as an annoyance, ask yourself this question. Think of it not just as a symptom, but as a message, a clue in the complex mystery that connects your entire body. What is it really trying to tell you?